we're gonna mostly do this during a cysto, so the patient will be prepped as a cysto. The doctor's probably gonna either not be able to get the scope in, or they're gonna be coming into CS4 stricture, so we can kinda pull things aside if you have a heads up that way. But pretty much you're gonna be standing there and he's gonna be like, yep, no, I need either, if it's Dr. Block, and pretty much I think Dr. Block only, the filiforms and followers, or guide wire with the Hamans, which are the hollow tubes, or they will want the Van Burens, which this is, you need to open these with sterile technique, flop that down, pretend I have gloves on, and then pretty much they're going to be standing there while you run around and get this, and you either want to open it either on the cysto table kind of like this, but pretty much you're going to need to set the scope down to keep that sterile. So it's either a matter of just opening it and trying to, plop it down nicely and keep it sterile on the table. You want to make sure they have enough lubricant to dip it in. They'll probably just start grabbing or start going. So if you have a second,
do we have to put them in order by size for them?
It's the best if you can arrange them in French size for them. Sometimes it just depends on how fast and how
Because
anxious they
Dr.
are.
Block's too
They'll
old to
just-
see 'em.
Yeah, they'll just start grabbing them. They'll start looking. But the French size is right on the bottom. So you start slowest, and you want to, of course, put it in easier reach for the doc. So 14 on up to the biggest one, I think, is 28 or 30.
Huge.
This is a 30. So on up to 30. So you want to try to arrange that, and sometimes they're just going to get in the way and start grabbing. While they're doing that, you can arrange them. So then the doctor will just take over from that. Typically, after most dilations, the patient's going to need a catheter, so you want to have a catheter ready. Depending on what size they dilate them to, probably going to be at least a 16, if not 18, sometimes higher. So you can, while they're going, and ask, because we don't keep anything higher in the room, so you're going to need to run and go get a catheter. So that's Van Buren's. Basically just opening, keeping it sterile, making sure they have enough lube, and then just getting a catheter ready. For Dr. Block, he will use the filiforms and followers, or the Van Buren's pretty typically. So again, open it sterile, and you want to try to get that on the table in a sterile fashion. And then he will start with one of the smallest guides here, and then he's going to again start with the French size lowest, so you want to try to arrange that or just get out of his way if he starts grabbing. You screw on to the end, and then this kind of follows. You'll put it in, dilate the patient, and again, then you're just going to need to have a catheter ready for him to go when he's done. So that's pretty much the same thing. Dr. Force, I know pretty much will use a guide wire. I don't know about the others. It kind of just depends if they're not able to pass either any of these easier, then they may say, I need a guide wire. We have these nice little kits with everything you pretty much will need. There will be the guide wire, the console catheter, and I think most of them have, well, this has got an 18, it'll be either a 16 or an 18. You want to double check with the guys to know which,
Sorry, is that bothering you?
to know, as long as I don't
She
have
just
this
looks like
big
she's
thing on my
she
part.
looks like she's jaundiced.
So it'll be a 16 or 18 console. When they're all done dilating, that'll fit over that. There's also some sterile gloves, the catheters, and then a syringe, or the catheter bags, and the syringe to fill it. So with this, you want to open up the guide wire. And this sometimes can get tricky because it has a little spring action to it. So keep that on the table. And then you also want to, we'll need the Hamans, which look like filiforms and followers, but they don't have that little filiform. And again, sterile technique to open. And then again, you want to try to arrange them in order, the sterile gloves. Then you'll hold the guide wire up. The doctor's going to grab this, put it through the little side cord on the scope. He's going to put that all the way in the patient. Meanwhile, you just hold. They're going to get this in the patient and just dispose of that. So this will be in the patient. Doctor's going to be holding it here. And then you want to get these that are nice and stuck together like licorice from the steam. So depending on how small that stricture is, I think these go down to a 10. So he's going to take the end, put it through. So I the fun, depending on how much caffeine everybody's.
For your eyesight.
So he will hand this, you hand him that, or he'll grab it, he's gonna put that over, and then you're gonna be here. And this is where it gets tricky, you wanna try to do a sterile glove, but if you don't, they're just gonna kinda keep going. Doctor's gonna push this through the patient, take it back up. So it's a lot of hand over hand. So slide this up, he'll take this, you're gonna switch hands, and then he'll just keep going on up with the next one. So again, if you don't have sterile gloves, and if things get contaminated with this, it always does, it's gonna get kind of bloody, it's gonna be kind of goopy and wet
They want you to
everywhere.
have sterile gloves though.
So you wanna try to
Because you're
keep it-
taking that tip of the Hamans and going on the end. So if you're touching that end with non-sterile gloves, and all those germs are gonna get passed into the patient when he pushes that dilator.
That's what I was taught,
Pretty
keep one
traditionally
sterile and
though,
one
something
non.
gets contaminated,
I know,
so you
but
wanna.
we should try that.
Right, you wanna keep it as sterile as possible. If you've noticed that something's gotten touched that maybe the doctor hasn't seen, then you wanna mention it, hey, do you need antibiotics? Does the patient need something, some either amp and gent, or do you wanna send a script for Cipro or Levoclaim? So double check, especially if the patient's compromised. So that is pretty much that for that. Then when he's finished, you wanna open up the catheter, and then, I'm not gonna open this because it's expensive. The catheter has, everybody's familiar with what a console is, so it's got an opening tip. It looks basically like the Hayman dilator. So then he'll be able to pass the catheter over that, put it in, and then you wanna make sure you have the syringe filled and ready to hand to him, because the doctor will put the cath in. You wanna also keep that the cystoscope sterile, because a lot of times they'll want to scope again after. Sometimes they'll put the scope over the wire. So again, it's just a lot of hand back and forth.
Yeah, so if they ask for a guide wire, make sure you put that scope on the table and, make sure you're not contaminating it during your procedure, because they generally, wanna go back in there and look a lot of times after they put the guide wire in.
Any questions about these? All right, and then Lori asked me to also show the female dilators. It's really rare that we do this anymore. Most of the patients have pretty much phased through. I don't think we've had a new female dilation in years. There's a few yet that see Dr. Blanc occasionally that he will dilate. But if you guys wanna pass these around and take a look, if you're not familiar, those are the female dilators. Usually they will do those in the room for a patient, and then you just wanna prep them like you would for a cysto. And then, this time you would use a lidocaine Jet for them to give them a little bit of lube and numbing. And then doctor will just pass that through and do a dilation with the urethra. We used to do a little suppository afterwards that had an antibiotic and a numbing agent, but they're so infrequent, we just haven't been using them. So that's female dilation, and then pretty much after, they usually give them an antibiotic tablet or for a couple of days. But the doctors will put that order in. So that's pretty much what that is. Any questions on that?
Thanks, Becca.
Sure. All right.